New Jersey's healthcare landscape is both challenging and competitive because neighboring hospitals often compete for patients with each other, as well as with hospitals in New York and Philadelphia. The passage of the Affordable Care Act is changing this dynamic, emphasizing quality of services provided, not the volume of tests performed or patients treated. Healthcare providers and hospitals are also being called on to assume roles as educators, developing new programs and outreach initiatives that focus on prevention and keeping communities well. St. Peter's University Hospital and Robert Wood Johnson University Hospital are less than 5 minutes apart in the heart of New Brunswick. And together, they are moving forward to collaborate, not compete, in the post-healthcare reform environment. Their first step, a community needs assessment. Supported by a generous grant from the Robert Wood Johnson Foundation, this assessment identifies critical healthcare needs in the communities both hospitals serve. After months of gathering data, key stakeholders in healthcare and government gathered to announce the release of the Community Needs Assessment.
From the talented minds at both Robert Wood Johnson University Hospital and St. Peter's University Hospital have teamed up on the Community Needs Assessment Survey. The results will give us a more complete view on how best to serve the needs of our residents.
Robert Wood Johnson University Hospital and St. Peter's University Hospital are committed to improving the health status of their community. This assessment helps us develop a roadmap, a course of action for us to improve the health status of our community.
It was very important for Robert Wood and St. Peter's to come together through Rutgers and the Robert Wood Johnson Foundation to do a total assessment of our community, to look at gender, to look at race, to look at access points, to look at any impediments individuals may have to receiving health care before we collaboratively work together to address those needs.
That was really the ultimate goal, was to help support these collaborations, to work together, to make sure that they knew all of the resources available in their community, not duplicate efforts, so that they could identify the needs in the community and then work with the hospitals to ensure that those needs are being addressed on a more strategic, ongoing level.
It is wonderful to see such a great collaboration between these two fine institutions. We're so fortunate in Middlesex County, and I can tell you as chairperson of the Health and Public Safety Committee, how fortunate we are that we have two such fine institutions in the city, in our county, providing outstanding service.
So this is a way for us to listen to our customer, which is the person who needs health care, and respond to them in the ways that they say they need us.
We've got good data on the needs. Our collective job is to figure out the most effective and efficient ways to deliver the services that meet those needs.
I'm happy that we have that kind of information because I think it allows us to even target more specific those groups or those areas or those communities. And I think this gives us a lot of rich information so we can strategize on a better way.
The assessment identified some significant disease concerns found in the local population.
The greatest concerns seem to be around the growing epidemic of obesity and the high level of chronic disease. Also reports of a high prevalence and high levels of concern about asthma and diabetes, two very difficult to manage conditions.
It also documented the prevalence of risky behaviors found in area communities.
The fact that people are not getting screened, for prostate cancer, the fact that individuals are not really getting screened for HIV.
Access to health care and the delivery of services were analyzed too.
One of the things we found with the focus groups, we had someone say, I know where to go for a hammer, but when I have a pain in my leg, I'm really not sure where to go.
The diversity we celebrate in this area, this is perhaps one of the most diverse regions in the nation, raises real challenges as well. Language barriers, cultural barriers, system navigation problems that really rose to the top.
When you finally see the final product in terms of the report today, right, it really signifies the beginning of the work that we got to do, because it was told to us by the community.
Lots of interviews, surveys, analysis of all kinds of data sets, but it's just the start. What comes next is the engagement of the community health leaders, the planning of programs, And really now the work starts.
So we are integrating the community health needs into the both hospitals' strategic plan process. We are developing a community health improvement plan where we will create a larger coalition of community residents and also agencies and resources in our county level. So it's going to be a more holistic kind of approach where we can do these interventions that will touch a larger number of people.
Faced with potential reductions in federal and state aid due to provisions in the Affordable Care Act, Robert Wood Johnson University Hospital and St. Peter's University Hospital have taken the lead in choosing collaboration over competition.
We do share the same community, and so we need to share our responsibility for providing great health care in this area.
We will partner with education organizations, with social organizations, and other health organizations in our community, and I look forward to that.
It is a real impetus for the two hospitals to get to work, working together.
The collaboration between the two hospitals is just incredible. To see them sharing resources and working together side by side to address the needs of their community is just impressive.